life, I grew up in Manila, Philippines, and the other half here in Phoenix, Arizona. But my whole life, I've appreciated how this drastic change in scenery opened my eyes. I have personally experienced third world poverty, middle class, and poor middle class America. And this really changed who I am. When I entered ASU, I was generally interested in these topics. And my education just reinforced my resolve to go back and help impoverished people around the world. But I noticed that it's not really simple or easy, and I'm not Superwoman. So I did notice that interventions usually would go into these different countries, and they didn't really have extensive knowledge or real relationships with the people they're trying to help. So how does that work? As an example, in developing nations, diarrheal disease is a big cause of child mortality. So in Honduras, a cheap, easy to use oral rehydration program was implemented. And it wasn't really effective. It wasn't a complete failure. But the fact is, they didn't really have extensive knowledge of the people's personal beliefs or cultural beliefs. And so the majority of the people didn't even use these programs. So that's a big problem. Well, because that happens so often, it's really, really sad to see that interventions like these could be so effective. And it's sad to see that it's still happening today, where we go into these different countries, send supplies, and then pick up and leave, and then what? It's like a Band-Aid on a broken leg. So a professor of mine told me about her colleague and this non-governmental organization called Globemed, and that their mission would truly resonate with me. So a group of students and I went in and researched their organization some more, and I absolutely fell in love with everything Globemed stood for. Globemed partners students with organizations around the world, even in the United States, that are already working and helping their own communities. So, and this partnership involves hand-in-hand working together with regular communication and a multi-year commitment to one another. Meanwhile, students in their universities are being equipped and they are educated and to become really, really good advocates with global health equity. And then this is all tied together with empowerment, propelling this movement forward of fighting and working for global health equity for all. So what does this mean? Well, let's take a look at an example. George Washington University was partnered with Rwanda Village Concept Project. And in their first year, their mission was to refurbish this clinic that was completely devastated by the genocide 12 years prior to it. Then the next year, they worked on using this clinic to educate and train leaders and mothers in maternal health programs. After that, they gave the most vulnerable women a plot of land and a goat. Okay, so that goat made even more goats. Those goats were then given to more vulnerable families. And not only does that give them food, it's a source of income that by selling goat byproducts like milk and cheese. And this is a cycle, and you're working with them throughout the entire time. This is huge. This is a collaborative, mutual benefit that encompasses the students learning and working with the partnership, and then the partnership community building itself and sustaining itself. And I absolutely fell in love with it. I was like, this is exactly what I want to do. I want to help people help themselves. I'm not better than them. I'm not above them. I want to work with them. So eventually I co-founded a chapter, the very first chapter of Arizona here at ASU, and we're partnered with ICOD Action Network in Uganda. And our first year is this year, and we're working to construct and build a home for vulnerable children that have been directly infected or are orphaned due to the HIV/AIDS epidemic. And in the end, this is my passion and this is who I am, and it can be yours too. You don't have, this doesn't have to be your whole life, but you can get involved. We need advocates, we need manpower, we need donations to make this thing real, and we need you, our world needs you. So.